how is genetics used in your specialty?
While I don't do any genetic testing in the emergency department, it's very helpful to know a patient's genetic profile for deciding what diagnostics to run. For instance, if somebody comes in and I know they're a factor V Leiden mutation, that really helps me to figure out whether I need to do an ultrasound to make sure they don't have a blood clot in their leg. If they're having leg pain, if they're having any shortness of breath or chest pain, I'm much more worried about blood clots in the lungs. Knowing a patient's genetic profile can really assist me to get to the most deadly things that I'm going to see in the emergency department faster.
The most common thing I see these days is hypermobility in terms of genetic testing. I don't know if it's because there's more hypermobility or we are more aware of hypermobility, but there are a lot of people coming in and saying, I've been told I'm hypermobile, I don't know what to do about it, do I need genetic testing, period.
So believe it or not, I use genetics quite often, especially in the situation of male infertility. When men come to me with a very low sperm count or no sperm, I'm often doing a genetic workup because as we, at least you know, there are certain things like Klinefelters, which is actually very common in the population that can cause low sperm count. There's also something called a Y microdeletion, and that's kind of important for our ability to counsel patients on whether we can find sperm if we need to do a surgery to extract sperm. Very important. Genetics, we need it. We need more of it. Keep going.
I love it. I love that you're aware of all of that.
Well, thanks to education from great people like you online.
Thanks.